Hey, this is Dr. Kajiki of the Valley Thyroid Institute. You're not going to see my mug today. We're going to talk about anemia triggers. I often talk about triggers, and triggers are the root cause of your problem. It doesn't matter what the diagnosis is, these triggers are at the root cause of your problem. If you're taking medication and it's still not working, it's very likely these triggers. Today we're going to talk about an anemia trigger. And when I mention anemia, one of the first things people tell me is, oh, my iron's fine. Well, anemia is not just about iron. Yes, it's probably the most common anemia, but we're not always talking about an iron anemia. There are many other anemias out there. And in order for you to troubleshoot and find what if you have an anemia trigger, is you have to do the Cbc panel. And this Cbc panel contains these different markers from WBC here all the way down to basophil. This is the differential right here. And these markers here, this is what's going to tell you what kind of an anemia there is. The MCH, the MCHC, MCV. And there's different kinds of anemias. There's a microcytic hyperchromic anemia. There's a normalcytic normalchromic anemia. There's a megaloblastic anemia. It may be a B12, a B6, a B1, a folic acid anemia. It could be an iron anemia. It could be a mixture of all of those. It could be a mixture of some of those. But you can see here that these markers show these different anemias. All right, and so it's not just about iron anemia. It could be other anemias. And when people think they have anemia, it's because they feel fatigue. And fatigue can come from any of the 9 triggers: anemia, blood sugar instability, adrenal dysfunction, hormone imbalance, inflammation, gastrointestinal problems, food sensitivities, chemical sensitivities, hidden infections. So when someone says they have an anemia, it's not just iron and supplement them with iron. Okay, it could be completely different. Maybe the iron is low, but maybe you have these other anemia markers. Maybe the iron is normal. And if you don't do these other markers, you're never going to know. Okay? Maybe your iron is fine, but maybe your storage portion of your iron isn't okay. Right? So you really got to do a comprehensive blood panel with the right kinds of tests. And I can tell you that most traditional medical doctors don't do the right kinds of testing to look for these different types of triggers.